Sir, over to you.
Thank you. Hello, good morning, doctors. Welcome to this experience sharing program on managing PPH.
Yeah,
Case studies from labor room. This program is brought to you by Hetero Healthcare. Hetero Healthcare, the snapshot, we have got 25 years of excellence with 36 state-of-art manufacturing facilities. We have 300 plus products in our portfolio and presence in 126 plus countries. Hetero Healthcare has 21,000 employees globally and is one of the largest closely held pharmaceutical company in India. We are amongst the largest manufacturers of ARV, APIs and FDFs in the world, and we have Asia's largest API manufacturing facility at Visakhapatnam, Andhra Pradesh. Hetero Healthcare is 360-degree solution provider, striving to fulfill unmet healthcare needs, reaching to customers across India with wide product range encompassing multiple specialties. Hetero Healthcare pioneers in quality and innovation and has the distinction of bringing 4 biosimilar products to market within 5 years of initiation. In today's program, experience sharing program on managing PPH, we have got honorable speaker Dr. Uttam Kumar Ray with us. Welcome, Dr. Uttam Kumar. Dr. Uttam Kumar Ray is MBBS General Medicine from Calcutta National Medical College and Hospital. Sir is Senior Medical Officer, General Medicine and is a trained gynecologist in Asansol district for hospital for past 20 years. Sir, now I'll run your presentation. Over to you, sir.
attorney and postmortem humanity and management. Then postmortem humanity. Daunting event, yes. PPH is
We are not able to hear you clearly, sir. You're on mute, sir.
PPH is loss of postmortem humanity, yes. The loss of at least 500 ml blood following vaginal delivery and at least 1000 ml blood in case of cesarean section, C-section. Postmortem hemorrhage, it's unfortunate yet common. Maternal mortality, leading cause of maternal mortality, according to about 55% of all maternal deaths. MMR in developing countries was 240 per 1 lakh live birth compared to 16 in developed countries. Maternal mortality ratio, the global PPH incidence, 14 million women after suffer from PPH. Incidence of PPH is reported as 2 to 4% after vaginal delivery and 6% after CS, cesarean section. Etiology of postmortem hemorrhage. What are the etiology of postmortem hemorrhage? The first postmortem hemorrhage etiology is loss of tone, uterine tonicity, inability of uterus to contract, which may lead to continuous bleeding. Second is a thrombin, coagulopathy, in clotting. Third trauma, uterine trauma, injury to birth canal, rupture and uterine inversion, lacerations, etc. Tissue, retention of placenta and clots and abnormal placenta. The clinical findings in PPH: abdominal tenderness, circulatory failure, increasing abdominal girth, loss of uterine contractions, and maternal tachycardia and vaginal bleeding. Second, Diagnosis of postpartum hemorrhage. How you diagnose postpartum hemorrhage? First, rapid assessment of patient's status, presence of tachycardia and hypertension, assessment of vital signs and blood losses, the assessment of the entire genital tract for lacerations, hematomas, or signs of uterine rupture, manual examination for retained placenta tissue, assessment with bedside ultrasound to check if the uterus is non-contracted, evaluation of uterus to check for uterine inversion, then complete blood count to check hemoglobin, hematocrit and platelets, coagulation studies, and assessment of fibrinogen. Approach towards postpartum hemorrhage. First, poor uterine tone. Second, tears or trauma. Third, retained products. Rational for the development of carbetocin in new heat stable formulation. Carbetocin is available in a room temperature, stable formulation, and convenient vial presentation. Carbetocin, oxytocin, and alcohol alkaloids should be kept in a refrigerator to avoid degradation. Heat stable formulation of oxytocin is currently not available. Previous formulation of carbetocin should be stored between 2 to 8 degrees centigrade. Resorts have cold chain, transport, and storage capabilities. Need for refrigeration. Yes. Carbetocin is stable at room temperature, has shelf life of 24 months at 30 degree to 75 degree, 70% turbidity and humidity. Avoid needs for cold chain storage and logistics is provided in a higher. Uses of uterotonic agents, time of administration. At the crowning of baby's head, at the delivery of anterior shoulder, or at the end of second stage of labor, following the delivery of placenta. Prophylactic use, prevention of PPH, active management of third stage of labor, and therapeutic uses, management of PPH with PPH. Molecules. Eh? And drug, yes, synthetic long-acting analogs of oxytocin. That is therapeutic indication. Prevention of postpartum hemorrhage due to uterine atony. আচ্ছা Poshocol administration is a oral. One vial contains 100 microgram of carbetocin in 1 ml solution for injection. Carbetocin efficacy and safety of carbetocin versus oxytocin. Carbetocin is non-inferior to oxytocin, who campaign that campaign trial WHO campaign trial, carbetocin decreases need for uterotonic agent versus oxytocin. Single dose carbetocin versus continuous infusion of oxytocin. Yes. Comparison of carbetocin versus oxytocin with respect to the mm, reduction in blood loss, and efficacy and safety of carbetocin versus symptomatic. Efficacy and safety of the carbetocin versus class of as per the champion ranks, carbetocin inferior to oxytocin trial been given the largest clinical trial in the prevention of PPH. Guideline recommendations. Well, in 2018, only one of the following carbetocin. Second, carbetocin 100 microgram IV bolus. Carbetocin Figo. Carbetocin one of the recommendations for PPH management. Germany, Austria, and FCOG France 2015.
Bivas?
First, doctor is logged out.
Yeah. Bivas, are you there?
1 minute, I will meet him personally
Okay. Okay, sir.
because uh, because- yeah, sir, check his-
The doctor has joined.
yeah, just Dr. Ajay. The Bivas is in meeting.
Yes.
Yes, sir.
The carbetocin as a smarter, superior, and safer choice compared to oxytocin.
So there are some questions which I will ask you, which have come. Which form of carbetocin you use generally, IV or IM, sir? IV.
IBS. Yes, IV is better.
And sir, where in which patient is
Yes.
PPH common? Yes.
What is the patient profile where doctors can anticipate PPH? Yes. Patient profile in case of primary
Yeah.
gravida, trial labor, uh, and child labor and polyhydramnios and a prolonged labor fasting, prolonged fast
Okay.
and the chances of PPH is more. Other than uh, other than multiparity and your secondary cause of PPH is so if you treat primary gravida in seizure due to preeclampsia and eclampsia by Maxal, it causes uterine atony. So there is chance of PPH in case of the primary gravida.
Okay.
And if there is a chorioamnionitis. As prolonged labor, chorioamnionitis has developed, then chances of PPH is more.
Oh.
If a multigravida lacks uterus, the during delivery causes PPH. Uh,
Retained placenta, sir, any experience you have got?
yeah, placenta is anyway one of the most important causes of thin placenta.
And in case of
In
Rh negative mothers,
Carbetocin in Rh negative mothers, yes, we can use
we
Rh
can.
negative mothers in case of PPH. There is no reaction.
If oxytocin is used for induction, can you use carbetocin for prevention of PPH?
Oxytocin is using repeatedly to induction of
Ah,
labor, then the myometrium is lax and then the causes of PPH is more. Then you may use to protect PPH carbetocin.
carbetocin. And you prefer IV route, you said, na?
Yeah,
Any
IV route.
adverse effect?
I
Any
prefer
adverse
IV.
effect you have seen, sir, with carbetocin? Any adverse effect you have seen?
Any adverse effect with carbetocin, if you give slowly IV, then a chances of headache and vomiting and GI disturbance is less.
Okay. And if the patient doesn't respond to carbetocin, what additional uterotonics you use?
If a patient is not responding and were carbetocin, then in order to prevention of this additional uterotonic, would you use? You may add another tranexamic acid, the IV route,
Tranexamic. Okay.
along with carbetocin.
Okay.
Uh, and last, if মানে, PPH is not controlled
Huh.
by manually and by drugs, then last choice is surgery.
Yes, surgery. Correct. Advantage of carbetocin over other uterotonics?
Uh,
Advantage of
Advantages
carbetocin.
of carbetocin, other we identify. Like carbetocin can keep in room temperature up to
Huh.
30 degrees, and onset of action is 2 minutes only, and duration of action is 2 to 4 hours.
Yes.
Where others we but lead to additional uterotonic process on a significant, on a 3 times safer than any other
Yes.
molecule.
Should it be kept as reserve drug or the first line? You are using it as a first line, no?
Yeah, should carbetocin be kept as reserve drug or it should be used first line? The at present in this situation in a country, carbetocin to keep carbetocin as first line.
First line, correct, sir.
Yes.
And to conclude, sir, what is your experience? Take home message for the doctors.
What their essential message? They, if you uh, you are doing obstetrics practice and a gynecological practice, then you will have to assess the patient antenatally, which patient will suffer from PPH. The examination is very important. In the case of primary gravida, if the primary gravida is PIH, pregnancy-induced hypertension, then there is a chance of PPH at the time of delivery.
Delivery.
You have to for that reason, and you will have to keep it may occur. So, and during separation of placenta, you will have to look that the placental cotyledons are all cotyledons 20 coordinators are there in the aim. So you will have to take the action immediately.
Immediately. Right. Thank you so much, doctor. I mean, because of network issue, I'm sure it was but thank you so
Yeah.
much for sharing your experience. Thank you so much. Thanks for taking time for this webinar, doctor. Thank you. Thanks all the doctor who took time and attended this. Wish you a very pleasant day, sir. Thank you. Thanks, Nagadevi. We can log out, sir. You can
Thank you.
log out. Thank- Thanks, Nagadevi. We can log out.
Okay, sir. Thank you. Bye, sir.
Okay.
Bye, viewers.
Viewers is in meeting, I suppose.
Oh, okay, okay, sir.